The next program is the Florida Healthy Kids Corporation, and that will be presented by Steve Friedman and Rose Naff.
Thank you and good afternoon. What I'm going to do right now is to walk you through the evolution of an idea, and then I'm going to address point by point those points of interest which you revealed to us in the letter that you sent us. When my daughter was in the 3rd grade, she came home with a flyer from school that offered me, for $35 a year, hospitalization insurance that would cover, $2,500 a year of hospital care. And working in a medical school as I do, I know that's one day in the ICU. But they were marketing some kind of hospitalization insurance to kids. And in that same period, I got a flyer from one of the professional organizations that I belong to that offered me major medical insurance as a result of my membership in that organization. And the Institute for Child Health Policy in that year had done a survey to find out who were uninsured in Florida, and given our take on the world, we noticed that about 2/3 of all the people who were uninsured in Florida were related to a child in school. So I put one and one together, and I came up with the idea and wrote it up, that maybe we ought to, since employment as a grouping mechanism for health insurance was not creating any new groups, that maybe we could use school districts as a grouping mechanism, since so many of the uninsured were related to a child in school. The article was published in New England Journal of Medicine in 1988, and shortly after that, as you might expect, because of the publication itself, people started coming and offering us dollars to determine the feasibility. And here we are with a 5-year-old, very successful program, and I will address point by point some of the things that I know you're interested in. For instance, novelty. What we've done essentially from a public policy standpoint is change the legislature and the public's thinking about what can be a large group for health insurance. The history of health insurance has been all employment-based. Now we're creating large groups as a result of people's enrollment in school. As you may remember, in the '88 period, there was a lot of talk about health insurance and how the healthcare market for health insurance was drying up, and most particularly for kids, and that is true. Some of you may have been in Washington a week or so ago when it was announced that yet another 1 million children last year fell out of the insurance market. Is it a significant improvement? Well, given the deterioration in health insurance coverage for children who are not on public programs, these are middle-class kids, we think of it as a significant improvement. It's a new service concept, which is one of the issues, and that is, once again, we've created a new way of grouping for healthcare and covering thousands and thousands of kids. The effectiveness of the program, well, the insurance department in the early days predicted that we would probably have about a 15% market penetration. Indeed, over the life of the program so far, we're noticing at least 2 or 3 times that level of market penetration. In the first site, market penetration went over 50%. And there are a whole bunch of issues around that resolved in and of itself, which I can't address in this time frame. There are now some 47,000 children enrolled in this program, and it continues to grow. So the effectiveness is fairly well established. Replicability is a very interesting issue as it relates to the Healthy Kids Corporation. And by the way, Rose Naff is the chief executive officer of that corporation. Each site, each of the current 16 sites, which represent about 1/4 of our school districts in the state of Florida, as a community process, decide on what kind of benefits and what kind of premiums they are going to establish. So in our state, it's been replicated 16 times with different adaptations for different communities. The state of Texas and the state of New Hampshire have passed laws to develop that program within their own states. And very recently, although it hasn't yet been announced publicly, the Robert Wood Johnson Foundation has authorized a national program of projects to make available this program to 5 to 7 additional states. So replication is something that I think we're very proud of, and I stand before you very proud just to be here. Thank you.
First question from Max.
One of the things that's impressive as you read this is that you cut through a lot of the bureaucracy and some of the rulemaking. Have there been pressures to reinstitute some of that? And of course, one of the examples is the verification of family incomes, to take a system that was in place and just adopt that. It would seem to me that the nature of government is to begin to push you to do to do more careful analysis and establish more rules. Is that pressure, is it there?
No, it hasn't been. What pressure we have had is to find an alternative to the school lunch program, because not all children have availability of that program if they're in private school. So we've been looking at creating community-based organizations who could do eligibility in addition to lunch program.
If I could just, of course, that's normally the way we begin to, there's a part of it that's not covered, so we want a rule, we want something to do that. Is that a concern in any way that as it becomes successful, you get more things like that? And as you move to different jurisdictions, they're going to have different, to tailor it and to allow the flexibility.
And we do allow them to tailor it, and usually the pressure to create an additional mechanism has come from within that community, and that community is the one who solves that problem. They create some sort of volunteer organization that's already doing that kind of eligibility determination, will step forward and offer to do it for the kids in that community. So it's not adding to our administrative expenses.
Next question from Barbara, followed by Dot, by Jack.
I want you to assume for a minute that I'm a grandmother who lives in a school district that has the program, and I have just taken temporary custody for 6 months or so of my grandchildren whose parents are in a terrible car accident and they can't care for the children for some time. I'm sending lunch money with my grandkids so they're not getting school lunch program because I'm making sure they get lunch. But their family has no income at this point. The family that's in another state and I'm here. Are the children eligible in a program like this, or do you look at the caregiver's income rather than the parental income?
The income is the household in which the child, the address at which the child is living, and to which the school system in which they're participating. So if you're a grandparent in Miami and your grandchild is attending Dade County Public Schools or uninsured, K through 12, and the income that you report would be yours, and the child will be enrolled.
That assumes the grandmother is the one with the money.
The household, the
without
address,
the money, but the grandmother might be insured herself and can insure her grandchildren. I just was looking to see if there was flexibility in the program for unusual cases.
Yeah. It's the same premise that the school lunch program is, the National School Lunch Program is built on, is the household size and the household income, whatever that household happens to be, whatever that its makeup is.
Dot?
Yes. Can you give us some assessment of the future of this in terms of expansion into other counties of Florida and the legislative appetite for additional encouragement of the program?
Probably the easiest way to address that would be mention some of the results of our most recent session, because I think it illustrates the future for this program.
Yeah, I left after that happened, so I
okay.
don't know.
Well,
I don't know
news
what
for
happened.
you.
Yes.
We requested an increase in funding this year, and we want to expand the program to 3 additional counties. We requested an additional $3 million in general revenue to be matched against family payments and local government funds. Instead, we received money to expand to 7 counties, and we received twice or 2.5 times what we requested.
Thank you. Congratulations.
Thank you.
I should have
Jack?
left sooner.
Not that it was easy, but that's what happened.
That was a super good answer to the same question I was going to ask.
Then Antonio.
Where was I? I forgot my question. It's been answered. It was about the expansion.
Pardon?
It's been answered. It had to do with
fine,
expansion.
fine. Any other questions? Do you? Yes.
One. I come from a state which has
an interesting insurance policy as viewed from outsiders to the state, anyway, Illinois. How's the insurance industry been?
That's an interesting phenomenon. It has evolved over time, and the industry initially was concerned, but they also didn't recognize children as a market. They recognized employers and employees as a market. Benefit packages were designed with adults in mind. Children were just kind of an add-on thing. And when you look at the individuals who lobby for mandated benefits of certain things, they're usually adult-focused benefits. And we actually created a product that didn't exist in Florida, that the insurance industry didn't offer. They now are making filings with the Department of Insurance, and this children's only managed care product is becoming available. I mean, it really wasn't available before. They see it now as a market. They do provide the services through our program. It's competitively bid, and it is their market.
Interesting.